Okay, I've tried to record chapter 18 and 19 together. I'm just seem to be having computer problems and compressing, so I've decided to break it up and try to make it shorter. Your chapter 18 and 19 are the drugs that affect your autonomic nervous system. The first part, the adrenergic, in chapter 18 are the ones that affect your sympathetic nervous system. So your nervous system, you have the central and peripheral. Your peripheral is broken both into your autonomic, somatic, or your sympathetic and parasympathetic. This next slide, I made a picture showing you the division, what they do. This is a really good instrument for you to have. I'm going to have it in the next PowerPoint too, on the next chapter, to tell you what the sympathetic nervous system does. This is a release due to the release of epinephrine and norepinephrine that causes this response in the body. This is another picture to help you with the sympathetic or adrenergics. There's alpha 1 and alpha 2 receptors, beta 1 and beta 2. I remember beta 1 with one heart and beta 2 with two lungs. There's other things such as in the alpha 1, I have the picture of the eyes, but it dilates the pupils, closes bladder sphincter, vasoconstricts blood vessels, does a few things. Alpha 2 with hormone release, insulin release, and regulating norepinephrine. Beta 1, not just with the heart rate, but it also breaks down fat for energy. And on your beta 2, on top of the lungs, it dilating the bronchi, it breaks down glycogen and relaxes the uterine muscle. A lot of the adrenergic agonists, the ones that prompt it along, end in that ene, dopamine, dobutamine, aramine. Epinephrine is a non-selective. That means it doesn't pick any particular. You see, it affects these 3 receptor sites. So if you think of the sympathetic nervous system or the fight or flight, your heart rate's going to go up, your blood pressure is going to go up, your lungs are going to dilate so you can breathe, so you can fight or flight. Contraindicated because you certainly, with the hypertension or dysrhythmias, you do not want to increase those rates. Hyperthyroid because hormones are affected, and the heart rate. Pregnancy because you certainly don't want the uterus relaxed. Some more on epinephrine. Inotropic. Inotropic means it makes the heart squeeze, get a tighter squeeze, and increases your cardiac output by making the heart squeeze tighter and pump out more. Also is a vasoconstrictor, restricts those blood vessels on the outside, bringing more blood to the central area, used in anaphylaxis, very severe cardiospasms. You see it used during codes. Okay. Nursing interventions, just this is a biggie here, and avoiding cold medicines and diet pills when you're on this, because they often have some stimulants in it that will aggravate this. And you don't want to take histamines with this. Of course, you're monitoring everything that is affected by it. You don't want the adrenergics passed along in the breast milk. What else? And if you use these, you want to put them on a cardiac monitor. You want to monitor the urinary output, making sure you have good renal perfusion with 30 cc's of an hour of urine minimum. Albuterol is a selective beta 2, working directly on the lungs to promote bronchodilation. You can look in your table 18.2 that talks about the alpha 1, beta 2 adrenergic drugs. Some of the side effects will be tremors, nervousness, restlessness, dizziness, tachycardia. Usually the tachycardia and tremors are transient. Again, look at your wrists, which will be the same on most of these, just because of the sympathetic response, and these are contraindicated And you think of diabetes because you certainly don't want a greater breakdown of glycogen and elevating glucose. Going into the central acting, your text does a great job on all of these. I'm just trying to focus in on some things for you. The clonidine, a lot of enes on these drugs. The clonidine, methyl-dopa, they're used for hypertension, tachycardia, palpitations, restlessness, tremors. We'll get into it a little further when we get into the hypertensive drugs, but they can cause dizziness, urinary retention. Alpha adrenergic blockers. Here we go. So alpha adrenergic blockers, just think of what it's telling you. The alpha receptors, alpha 1 and alpha 2, look back at your picture of what that does, and it blocks this effect, so it's going to do the opposite of what the sympathetic nervous system does on the alpha 1 and alpha 2 receptors. And these, as you can see, often will end in that zosin or SIN ending. Prazosin is a biggie. All of these are, I know this one for a fact, to cause orthostatic hypotension. So you're certainly going to be careful with positioning because of positional hypotension, not getting up rapidly, monitoring that blood pressure. Then we get into some of the beta blockers. The beta, remember you have the beta 1 and the beta 2 on the sympathetic side, and that's what's blocked by these beta adrenergic blockers, or often called the beta blockers. Because it's affecting that beta 1, it's going to decrease the blood pressure and the pulse. Because the beta 1 does the opposite of that. By blocking it, it's going to increase it. The other is these non-selective, if they affect the beta 1, but if they affect the beta 2, it's also doing the opposite. So instead of bronchodilation, you can have bronchoconstriction, and you're going to use caution in COPD, even people with asthma, anything with as respiratory concerns. These often end, I don't know if I said that in the previous slide, on the olols, like here, OLOL, propanolol, inderol, atenolol. So a little more on these. The non-selective is propanolol, which means it will work on multiple sites, alpha and beta. So these side effects are going to be impotence, libido, decreased libido, reversible alopecia. Alopecia is a loss of hair on your head. Multiple drug interactions. You'll see many drugs interact with theophylline, which so that drug is not used as often anymore. And when you see NSAID, that's non-steroidal anti-inflammatory drugs. Those are things that decrease inflammation without being a steroid, such as aspirin, ibuprofen, naproxen, to name just a few. Be aware of some of the things like digoxin and calcium channel blockers, if they're used in combination with the beta blocker, can cause a severe heart block, which can lead to death, cardiac arrest, inserting a pacemaker. Again, continuing on with beta adrenergic blockers or beta blockers. These are selective, where they pick their site. Ones like metoprolol and atenolol affect only the beta 1, which is dealing with your vascular, but also remember your glycogen breakdown. So if it's blocking that, you're not going to have the glycogen release. Your blood sugar is going to drop. If your blood pressure is too low, you're going to get dizzy, faint, fatigue, and so it's going to do the opposite of the sympathetic, where Here you have diarrhea because on the sympathetic fight or flight, your gut shuts down. You don't need it. You need to run. It's supplying those vital organs. So if we're blocking that decrease, we're going to increase motility in the gut and can lead to diarrhea. And I think that is the last of slides, and we'll be getting into the cholinergics. Just your text, you want to go through, look at some of your charts in there, definitely go over. I focused on some of the major drugs, and you want to go through where it has all your nursing process, because that is very, very, very helpful.